Hello, everybody, and welcome. Pretty excited tonight. Actually, stoked. I have like guest of a lifetime on tonight, and I will bring him on and introduce him in one moment. How is everybody doing out there? I see we have a few people on already. I just have to get this on my iPad here for a sec. Give me 1 second. Okay, I'm on. Hello, the Zen Ginger. Can you please moderate for me tonight, if you don't mind? I'd really appreciate it. You do a great job, and I won't have a lot of time to be checking out the chat tonight, as it's going to be a pretty wicked conversation with tonight's guest. So, without further ado, I'm going to introduce my guest tonight. This is my fish veterinarian that I've used in my fish room, and he's graciously accepted to come on tonight and talk to us about some of the issues we have with our fish tanks that require veterinary care, what a veterinarian can do for you, especially in Canada where there's been some medication issues and whatnot. He's going to sort a lot of stuff out for us tonight. And so, yeah, I'm going to bring him on now. Please help me welcome Mr. Paul Manesis. Hello, Paul. How are you?
Good. How you doing, Jesse?
Very good. Thank you so much for coming on. I don't know how often people actually get to talk to a real live fish veterinarian. So what is your actual qualifications? I know you have a certificate in fish veterinary, but you're more than that.
Well, not yet. I'm planning. I'm trying to. I'm in the process of getting that certificate, but I've been in the hobby for years since I was a kid, and I've been practicing medicine up in Ontario for about 2 years now, and so yeah, those laws definitely changed, and it's been difficult for a lot of the hobbyists and things like that, and people to get those medications, and I figured I might as well apply my hobby and have some fun, right?
Yeah, that's what it's all about. And if I guess your expertise can help other people out and you can make a living doing it as well, then
Yeah.
it's all bonus, right? So I know you're a hobbyist. Why don't you tell everybody a little bit about maybe some of the fish you keep, or what you do with your hobby?
Yeah, absolutely. So currently I run a 16 and a half gallon display saltwater reef tank, um, and 3.5 gallon in the back. And I just got a few fish in there. Had a lot of high end coral, but it's very time consuming for that stuff. And sometimes if I'm out of the house a lot, it doesn't go too well. So I took a bit of a step back. I still run that tank. I have a right behind me is my newest tank, newest edition. That's a 65 gallon freshwater. I got a nice big flower horn in there, and having a lot of fun with that. He's really social.
Did you name them? Everybody names their flower
Yeah,
horns.
I did name him. It's the same name everybody names him. Fathead Frank, I call
Ah,
him.
yeah, that's like 5 out of 10 flower horns are named Frank.
5 out of 10, right?
Yeah.
But what else do I got here? So at the clinic, we have, I think it's like a 125. They run reef tank, and I don't maintain that myself. I look after it and stuff, but I don't really mess around with it too much. And the newest addition at the clinic is a seahorse tank. So um, we have Brazilian red eye seahorses, and they actually just bred. They had some babies, so I'm taking care of them. With in my basement, I have like, I don't know, like 8 tanks of Artemia. I separated different species of copepods, and then I kind of try to time the brine shrimp and Artemia, and then enrich them and things like that. But so I got a lot going on.
You're
But
busy man.
pretty busy right now. The baby seahorses are a lot of work.
So we never did say yeah, where's you're at Allendale Veterinary Hospital and you're in Barrie, and that's where people can find you if they need help with their fish, and I'm sure they're going to want to find you after tonight's live stream. That's great, Paul. So I know, I guess, why don't we start with what you did for me, because that's what I know we can talk about, because yeah, I hired you to come and help me with my fish because I had a problem. So why don't you enlighten people a little bit on that, because I know there is some you have my total uh, what's the word I'm looking for, uh, permission to speak about my veterinary case with you.
Yeah,
So
absolutely. So your case was, so I believe you called me and you had multiple cases of camellanus worms in your guppies, right? They were guppies.
yeah, guppies and plecos and
Yeah, yeah.
cestrus. Yeah.
So you were using at the time an over-the-counter. I think it was an over-the-counter fenbendazole, and I think it was dosed like per body weight. And so you did whatever dosing that they gave you on the instruction package, and it wasn't working. So you called me and you said, hey, I think there's, you first sent me some photos and stuff like that, right? We had a discussion and all that, and I came up and saw your whole setup, and yeah, in fact, they were definitely camellanus worms, but the fenbendazole that you were using, the over-the-counter meds, it wasn't really the proper dose. But not only that, given oral medications, so the fenbendazole was an oral medication, right? They had to consume.
Yeah,
the
that was the
medication.
instructions they gave for it. It was oral, and it was, yeah, mix it in with their food and then throw it in the tank. And I remember when we looked at the container, I saved the container for you. And remember, people, this was a long time ago too. This was like 2 years ago now. And I still have the container actually. But yeah, the dosage, when you looked at it, you laughed. You were like, this won't kill anything. And it was an Amazon special. It was a medication you could buy on Amazon, but it wasn't working. And we didn't know anything about medications. It was right at that time when we had to go through a veterinary to get certain medications. And I reached out to you, and yeah, that's why you had to come out and see my setup. Now, why did you have to come out and see my setup? I know the answer, but everybody else doesn't.
Right. So just like with dogs and cats, you need that veterinary client-patient relationship, and you generally you have to, in order to set up that relationship, you need to check out a setup. Just like if a dog's coming into the clinic, right, and you do your exam on the dog and things like that, and you need to have that's only good for about a year, and you need to renew that every year. Check in the setup, see how it's going, see. In terms of fish, like the biofiltration, the actual fish, do your diagnostics, whatever you have to do there. And it's kind of under law, we can't just give medications out, right, for any reason. I mean, and specifically the levamisole too. I mean, that's for every medication, but the levamisole has its own issues, right? So in terms of, human drugs and things like that, and they used to cut that for street drugs and all that, and humans that consume it, they can get pretty sick from it too. So it's not like I can just willy-nilly give meds away. But with that I mean, if you had like you had that veterinary client patient relationship, and I saw your camellanus worms or whatever, and we diagnosed it, and then you called me, let's say like a couple of weeks later or a month later, and you sent me a photo and said, hey, Dr. Manesis, I got the same issue. It's like, I don't have to drive out to see you. Like, I could say, well, it's the same thing. Here's the meds, right?
Yeah, it's developing a relationship like you would with anything, right?
Exactly. And I mean, in your case specifically, the fenbendazole wasn't working, right? So we dosed levamisole instead in the bath, so in a bath form. So if you were to do oral medications, you kind of say, hey, you got X amount of fish in the tank. You have to dose it by weight, right? So how are you really going to weigh out a guppy? You know what I mean? And then you would basically calculate how much you're going to need for, the daily intake. So it's just too difficult to do it orally. So we dose it in a bath form. Now that would work for the worms in your case, and work pretty quick. And as long as you're kind of attacking that life cycle and knowing why or how.
Yeah, you have to. And there's a lot of responsibility for the pet owner as well. Like, you can only do your part with helping with the calamanus worms. There's a lot of work that's involved to go with it too. So as you prescribed to me, it was an every 2-week cycle. We had to cycle the medication through them every 2 weeks, and we did it 3 times for a total of 6 weeks. But the work that went in, so these are things I did before I even contacted you, was I ripped all the I had a lot of live plants in the tanks. All the live plants went out and into the garbage. Just can't have it. All the gravel that the worms could live in went out. I didn't put it in the garbage, but it got bleached for like a month before I rinsed it out and used it again. Everything had to be sanitary. And then every time we did it, it was like a 70% water change the day after administering the medication. So, for everybody, it's you get a vet to help you get the medication and the dosage and tell you these things to do. But then there's a lot of work yourself. There's no, I was asked earlier today if there's an easy cure to calamanus worms, and the answer is no.
No, I mean, with the Camellanus species, it's like, they have this unique life cycle, right? I mean, I know someone asked about like parasitic worms later on, like we can get to that, but in terms of us right now with this, for your exact case, they have this life cycle where they go through different hosts, or they can go directly. So they could kind of act both, like they both need like an intermediate host, and they could have also direct host, right? And I think sometimes it's two intermediate hosts. So in that case, it's difficult to treat, and that's why you have to kind of match that life cycle. But it's not just like the life cycle of the parasite, because at certain temperatures it could prolong or quicken that life cycle, right? So I've read that it could at certain temperatures that life cycle could almost take like a month, right? So some people say you could treat weekly for a couple doses, others say like 2 to 3 weeks. I mean, I just said, a nematode, a roundworm, I just picked every 2 weeks for 3 doses, and it seemed like it worked, and it did work. Yeah, that's what I kind of just use, on a regular for now for those cases, and it seems to work. I haven't had any resistance issues or anything like that.
Yeah, and honestly, the only other way that I think, and this is me, not you talking, that you can get rid of calamanus worms is essentially destroy the tank. That's it's about the only other way. They're highly, highly contagious. Any nets you use from one tank to another will, and that's why I took it so seriously and called you, because like I had 3 tanks infected. Well, I had another 30 tanks that could have been infected and could have been a very costly affair for medications if they all got infected, compared to just medicating 3 tanks. It could have been a nightmare. So that was my first experience with working with the vet. One sec, I messed up. I need to plug my headphones in.
No problem.
I thought you were awfully quiet. That's better.
There you go.
Yeah, much better. Now we can shut this off, and our audio will be better too. Perfect. So, where'd you go?
Am I still there? Can you see me?
You're back. I lost you for a sec. Are you back?
Yeah, you hear me? You see me? You hear me, Amy?
I'm not sure if my internet's messing up here or yours.
I'm not sure. I think it's going pretty good.
Yeah, I'm froze. Shit.
Okay, take your time.
Am I back?
I mean, I see you. I hear you. I, I, I think you're frozen. All right, he's going to come out. He's going to come back in.
Are we back?
Yeah. I hear you now.
Yeah, I think I'm kicked out of live stream. Son of a bitch. Hello.
There you go. I can hear you.
My audio's staying, but I'm freezing. Sorry about this, Paul. I don't know why we're all froze up here. Trying to figure it out.
I think you're doing pretty good. You sound pretty good, at least.
I can't hear Paul.
You can't hear me.
No.
I don't know if anyone who's commenting can you hear me?
Keep going. Okay. I cannot hear Paul though. I don't know what's going on.
Here, let me see. Let's see.
Got it. We're good.
You got it. All right. Let me get out of here now. We go back. All right. Here we go. There we go. All right. We're
Sorry
back
about
now.
that, guys. This is our amateur technical difficulties. So calamatas worms. I don't know what I missed. What you were talking about? Calamatas.
The tongue
Camalanis.
There you go.
Yeah, I'm terrible with pronunciations.
So
that's why I bring smart people on.
No. I'm the same way.
So I guess what we were getting at is the only way I could get those medications was through a veterinarian. That was the only way I could properly cure that problem.
Right.
Now, we're going to get to another question later, and that's availability of medications and whatnot. But I guess what services can you offer to aquarium keepers? Obviously, medications. What kind of surgeries?
Well, medications and surgeries they're pretty different. So any aquarium vet. So it's pretty interesting. I only do.
Are you back again?
You hear me?
Okay.
Yeah.
Yeah.
So I only do pet fish. You need a special license for food animal and food fish. But any aquatic veterinarian, the services that they offer, usually it's going to be a mobile service. They'll go to your house or your storefront, or if you have, anyway, never mind. I forgot the term. Anyway, they go to your place, right, where you have all your fish, and they'll do your diagnostics. So your basic diagnostics for a fish vet will be your gill clips, your skin scrapes, your fin clips, and things like that. Taking fecal samples. What I found out is you're always under the microscope, right? You're always looking at things, and those are kind of like your basic diagnostics. Now, that's what I would offer. I do offer anesthesia as well, with approved anesthetics. Most fish veterinarians, I'm assuming, would have something like that. So doing surgeries are much different. I think they're a bit more difficult, but we can do that. Most fish vets will do that and can do that. They should know how to do that. And then if you go even further, is taking other diagnostics for like cultures or histopathology, postmortems. I only could do so much at for myself, but that's where you use like the pathologists from your local university or anyone in the area who is specialized in pathology, right? And you kind of use them as like a third party as well. But everyone works together, right, for a common goal, right? So you have the doctor, the veterinarian, the client, and then you have a specialist, right? So who like specializes, whether it be in pathology or, you know, something like that, right? So like if you were to go to the pathologist,
Okay.
you would take samples, or if you have like a massive fish death or something like that, you would, depending on the size of the fish, you either take samples and you send it to the pathologist, and they'll cut into little pieces, and they'll make their slides, and then they'll look at that under the microscope, right? So, and that's what they do, you know, for a living. So you work with them, you know, for a regular, you know, general, you know, fish vet like me, or, you know, other people out there. You know, we could take samples and look under the microscope, but we're not doing any of that histopathology. That's for the specialist.
Okay.
And they do, and those specialists, they'll see histopathology for other animals as well, right?
And I would say we're probably very fortunate to have Guelph University in Ontario for that.
100%, 100%, and that's who I'm, you know, in communication with. Anytime I have, you know, specific fish questions, and if we're sending a fish for sampling or something like that.
So, you're currently working towards going to be able to look after like commercial fishing operations? Is that the certification you were aiming towards?
No, not commercial fish. I mean, I don't know. It sounds pretty cool, but I don't. It sounds like a lot of, you know, I would probably like that, but no, I wouldn't do that. That's like a full time. You know, those fish vets are strictly fish vets, right? And they work in the food industry. I mean, I've met some people out in, let's say, like Nova Scotia who,
Oceans.
There was a position out there, but I mean, like, I like what I do right now, right? I enjoy it. It's for fun, and I like to educate people, and it's a hobby to me. And it's new for the hobbyists, right? So, you know, how to treat, like, even my dad, right? My dad has a koi pond, and he's currently, Dad, I think he's watching. How you doing, Dad? So he's currently, you know, talking to me about, like, you know, his koi pond. And I'm trying to tell him what to do, and you know, it's just kind of funny back and forth. We go back, but it's a hobby to me. I enjoy it, and educating the people that have pet fish is like what I enjoy most, because there's so much that people don't know about, or whether they don't care about, or, you know, they overlook because, you know, for whatever reason. I find it a bit more enjoyable. So the certification that I'm going for, though, it's through the World Aquatic Veterinary Medical Association. And that's a little certification that they've had to, I guess, kind of put like a bar on people who want to practice aquatic medicine, right? You don't have to do it. You don't have to get it, right, to work with fish, but it kind of pushes you to.
That's a standard.
Yeah, like, hey, look at those articles, try to see those cases, you know, follow up on things, and, you know, get involved, and
now that would offer like a continuing education program for you as well, right? So you would get more up-to-date stuff than someone who wasn't going for that.
Yeah, and I mean, that's what it's about, right? It's about learning and educating and things like that, and there's other things that you can go on, like, you know, in Ontario, there's a listserv that I'm a part of, and you find mentors, people who have been doing this that's all they do, and it's a lot of fun, and they help out so much, and you learn so much. You learn something new every day, and no matter what, and no matter how long you've been practicing this, and this goes with absolutely anything, like, nobody knows everything.
No.
Right. So everyone's learning all the time. So, it's sharing information is kind of, the best thing for everybody, right?
That's why we do this. I don't make any money off of this. I do this just to share information. That's why I get different guests on all the time. Like you're saying, not one person knows everything, but I feel if I get enough of a variation of guests on, you can take a little bit from every guest, and you can learn an awful lot that way, hearing it from different points of view.
Mm-hmm.
So yeah, that's what. Now I had one more question about the veterinary services. How many people like you are in Ontario? Like how many vets are comfortable with prescribing medication and taking pet fish cases on? Has it gotten bigger? I know it wasn't very big before.
I don't know. I don't know. I don't know. I don't know how big it is. I don't think it's that big. The the conferences and stuff that I participate in, there's vets there, but like, I don't know. Like, I don't. Everyone who practices fish medicine probably doesn't go to the conference, right? They probably just practice once in a while. I don't know how many people are really into it as much as I am. Like, I'm in the hobby and I know a lot of hobby stuff. And I apply that with medicine. So I enjoy it, I think, more than other people. I don't know though. I mean, I want to maybe third. I don't know. I really don't know. But
you're the only one available around here.
Yeah, maybe. I guess so.
Yeah.
I mean, I know.
When I went looking. Yeah.
Right. I mean, I know one who is kind of like my mentor, and I ask a lot of questions. And there's a few other people who are pretty active. Anytime I have questions or anything like that. But there's definitely more people out there, right? Maybe people are shy. Maybe people are shy and they don't want to. They're afraid to communicate. They're afraid to say something that they think may be a dumb question. There's no dumb question, right?
No.
But I don't know. I'm not sure. Probably a handful, maybe less than 30, less than 50. I don't know though, really, to be completely honest.
So they haven't set a bar for that yet. Like they haven't really set a standard for that.
No. There were definitely I would say a small amount, like probably less than 5, I'd say.
Okay.
That we're taking everything, doing everything, and I think it was just becoming more popular. And then after the laws have changed, people are going to call their regular veterinarians for fish help, and instead of having a small animal veterinarian or a large animal veterinarian say, well, we don't do that and whatever, and then everyone is kind of like, all the fish keepers and all the hobbyists are kind of screwed. So I think they wanted to educate
vets
those,
be a little more well-rounded,
right? And then maybe out of that you may get people who spark an interest. Like, for myself, like I love it so much, I enjoy it, and I just keep going and keep learning more and more. And
well, I remember you were a delight to have in my basement when you came. You were just like, yeah, you were more checking my fish out than I was. So I could tell right away when you came in that you were all about the fish. That's for sure. You knew your shit, so to say.
Yeah. I mean, I hope I do. I try to, but
So I just got something to say here. I noticed there's a chat going on here beside us, Paul, and there's been a couple of people asking questions. I just have to ask those people. Just wait. We have a pile of questions to go through already that I have actually written down here so I don't forget them. And these were questions that were asked by viewers before the show went on. So would you like to get into those now, Paul?
Sure. We can get into some of those questions. Absolutely.
Okay. So I think we should, because we got a lot of them. Everybody supported this a lot and took part. And that's what I wanted out of this live stream. I wanted people to take part, ask us some questions ahead of time, give us some time to come up with some good answers for you. And when I say good answers, I mean honest answers, researched answers. So you're actually getting the straight goods, not just off the top of our heads. That's why we did it this way. But we have 15 great questions here, and I don't know if we will get to them all, but we're going to do our very best. So the first question from our viewers was, would love to get some information on tumors on fish and how to identify them, and if there's anything they can do to help with the quality of life.
So yes, fish do get tumors. There's multiple different tumors. I mean, just like any other animal. I mean, you have, so I don't know, you have like spindle cell tumors that can be differentiated. Those are usually common in like goldfish and things like that. All the sampling is needed to really differentiate what spindle tumor you're talking about. Like, is it a fibroma or a neurofibroma or schwannoma, whatever it is, peripheral nerve sheath tumor. So you have your spindle cell tumors, papillomas. Those are pretty common as well. They could be like viral in origin. Definitely with like koi and things like that, like herpes viruses and whatnot. Squamous cell carcinomas, pigment cell tumors are another one. I think like beta fish can get them and things like that. And then they're all different. There's multiple different types of pigment cell tumors. I mean, they're all going to kind of look like abnormal growths, right? And there's also other things like lymphocystis, which is viral in origin as well, self-limiting. But
is there anything people can do to, I don't know, I guess help their fish through that, help with their quality of life with it?
Well, the quality of life is the question, right? So a lot of them can be benign, but a lot of them are cancerous. Like melanomas is a pigment cell tumor, and that's pretty cancerous, right? Like obviously humans can get something like that as well, right? But it's quality of life. Is the fish swimming the right way? You know, is it eating? Is it not really affecting them? Those are some of the things and some of the questions to ask. So identifying them is kind of obvious. It's like it's not normal. But what type of tumor it is, you got to take samples, right? Now, if you wanted to treat them, depending on what it is, like lymphocystis will go away on its own. I actually have a little skit on that on my Instagram or whatever. We could talk about that later, but
all right. I do have your Instagram to put up here for you.
Yeah, you could throw that up, and I'll just keep going. I'll just keep talking about some stuff. But the lymphocystis will go away on its own. A lot of the other tumors won't, and the only way to get rid of the ones that are going to be there that are actually like tumors are going to be surgical removal. So I would advise surgical removal if you know the quality of life of the fish is at stake, right?
Yeah. So, and I guess that's something. Yeah, it's a whole other ball of wax if you start doing surgically removing tumors. I'm assuming this would be mostly performed on like expensive koi and whatnot.
Well, yeah, I mean, in my case, yeah, probably. I mean, you could do it with anyone like goldfish as well. Anything, you know, but it's whatever the client wants, you know, like whatever you guys, how much is quality of life of the fish worth to you, right? I mean, it's not wrong if you say, hey, I'm going to euthanize the fish because, you know, it's not doing well, it's not eating, it's swimming, you know, it's like lopsided or whatever, you know, it's not wrong to do that. You know, a lot of times you could remove it. It may not be curative, right? It could come back. It can come back more aggressive. It could be spread the rest of the body depending on what it is. So it's not wrong. Like if you don't want to pursue that.
So I'm guessing as long as the fish is able to eat and it seems like it's enjoying life, pretty much. If you're worried about it, contact your vet. If you're not worried about it and you don't think you can afford it, just let it go until maybe it's not having a very good quality of life. I guess it's what you're saying pretty much, eh?
Yeah, I mean, I can't really comment on like anything more than that, but obviously go to your vet. I mean, some of them could spread too, but like the other fish.
That's a good point.
I mean, true cancer growths won't, but other ones that produce growths can. But yeah, like I would say, just go to your vet, and it's quality of life, right? If your fish isn't doing well, then obviously go to the vet.
Yeah, most definitely. All right, that's an awesome answer. So here's your next one. Is there any prevention meds mixes that a vet would prescribe for wild caught imported fish during quarantine, or just treat as needed?
I'm an advocate of treating as needed. So there are definitely a lot of people who import like lots and lots of fish, and they automatically will deworm, or they'll treat with some medication. And I mean, to be honest, like if you're importing wild caught fish or something, most likely it's going to have something, right? But just to have the mindset of, oh, we're just going to bring the fish in and treat with everything that we could possibly think of, dewormer, antibiotics, blah 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 blah, whatever it is. That's how you run into problems. So I would just say, you get your fish, quarantine. That is every single person in the hobby. You need to do that. If you're going to have fish, that is the number one thing that I would love for people to get out of. There's a few things, obviously, but quarantine is another one. Do not think you're going to go through this hobby without getting any fish. That's like, no fish is perfectly healthy. Well, sorry, maybe some fish are healthy, but don't think you're going to go through the hobby and you're never ever going to run into problems. So it could be devastating if you don't quarantine your fish, right? So as long as
that was your next question. How long should we quarantine our fish for when we get new fish?
So I do 4 weeks. There's some parasites, depending, like fresh and salt water, that could like harbor or go into like a cyst stage and surpass that time period. But I would say 4 weeks. If you think about it, a lot of the parasites, they're stress related. So if you're bringing a fish, you're buying a fish and you get it shipped to you, they're already pretty stressed out. So like the majority of the times, like if you're going to find something, you probably would find it within the first week or so. But I would recommend quarantine for a minimum of four weeks.
Oh, wow.
Yeah. But I would expect, if there was an issue, I would expect to see it within, sooner rather than later. But that doesn't mean, oh, quarantine for 7 days and I'm fine. Like, no, it doesn't mean that. It means quarantine for a minimum of a month and observational, right? Observational quarantine, watch them. And then if there's a problem, then treat the problem. And do not throw every single medication you could possibly think of at it. It's going to just cause you a lot of issues. It's just not smart. It's not the right thing to do. Not good for the fish either.
Oh, something a lot of people don't know as well. Like you start throwing medications like levamisole at your tank, it destroys your cycle. It destroys your tank cycle. It annihilates it essentially. So if you're throwing different medications that are going to affect your tank bacterial cycle, then you're kind of shooting yourself in the foot at the same time, right?
Right. Well, there's the way I kind of think of it is that majority of infections are gram negative, and the majority of your good bacteria is gram positive. So if you are throwing medications, specifically antibiotics, that will really hit gram positives really hard, like you're going to wipe out your biofilter, and now you're back to square one.
Yeah.
And that whole thing, like one of the things that I want to get people to understand is that whole nitrogen cycle or ammonia cycle, whatever you want to call it, like that takes a minimum of 4 weeks. Like it's not going to go quicker than that. A lot of that bottled bacteria has been proven they don't work. Like I was reading a paper the other day saying that, yes, the different types of bacteria that convert ammonia to nitrite and then nitrite to nitrate, there's a bunch of different ones, and in salt water and in fresh water, they vary. The ratios kind of vary, right? So a lot of products will be like, oh, this is bacteria for both fresh and salt water. It's
yeah.
But then you don't know how that's being stored. You don't know how it's being packaged. You don't know anything about it. But it takes like 15 to 20 hours for your bacteria in the fish tank to multiply. Okay, E. coli takes like 15 minutes. So
wow.
if you think about that time period, you're not going to cycle your fish tank in a week. You're
No.
not going to cycle it in 2 weeks. You need that long period. So the minute you use an antibiotic, that boom wipes that out. Now you're right back, right back to the beginning again. And then you have fish in there, no less. That's going to stress them out too, and it's just going to make matters worse. And then there's also even medications that your biofilter will degrade rapidly. So you put that medication in, the biofilter will like kind of understand this medication and it'll break it down. And then that medication, it'll kind of like, I can't really explain it, but you try to use that medication again and the bacteria kind of learns how to utilize that medication as like a carbon source.
So the bacteria in your tank is eating the medication before your fish will essentially get to use it.
Right. And like, not only that though, is that the interesting part is it'll have that learned response to it. So what I was told was that it takes like 6 months or so for all that bacteria to like fully turn over. So essentially, like technically, like if you were to use that medication again, you can't use it within that 6 month period. People still do. They change the doses and stuff. But the whole point of that is that there are some medications that will blow your bioload, and there's other medications where your bioload will blow the medication.
Right.
Will degrade it, really, not blow it, but you know what I mean.
Yeah. No, that makes perfect sense. Makes perfect sense. Another awesome answer. Okay, so this question, we talked about this, and it's the question is, how long does parasite worms, how long can parasite worms live in an aquarium without a host, in worms and in egg form?
So this is an interesting question because it's highly dependent upon hosts and the type of worm. So I'm assuming parasitic worms. I'm assuming he's talking about like nematodes, like roundworms and stuff. And if that's the case, they're like 650 species of roundworms, and they all have different life cycles and pathogenesis and things like that. So if you were to take one of them, which I guess we're on this, I saw the question about the Camellanus worms. Like we'll take this for example. There is a lot of different hosts that it uses, but generally, so in wild caught fish, the adults or larvae nematodes aren't usually a problem, let's say, at least in most cultured fish, is because they're missing that intermediate host. So like if you don't have a host, it's not going to be able to complete the life cycle. But in his case, I think if you were talking about these Camellanus worms, like an L1 larvae could be eaten by, let's say, an invertebrate, and then the invertebrate will be eaten by a fish, or the fish could act as the intermediate host and eat the larvae, and then another fish comes and eats that fish, or the fish can act as the definitive host, eat the larvae, and then get affected. So this question, if it's pertaining to this, which I think it is he's talking about that L1 larvae swimming in the column. How long is that going to take? Like, can you just leave that L1 larvae there, and would it ever die on its own? I don't have an answer to that, but like that's kind of the point. He's missing the point. The point is, it's the life cycle that it has, the hosts that it needs to affect to complete that life cycle. The life cycle is dependent on temperature and species. And like for the host, so you have like a final and definitive host, which contains the reproductive adult stages. You have an intermediate host that's required to complete the life cycle, but it doesn't contain the reproductive stages. And then you have paratinic hosts that can harbor the pathogen, right? So you could theoretically have like a paratinic host in your aquarium and not know it. All right. So there's no way I feel like this question is like, let me get around going to the veterinarian. I don't want to go see a veterinarian. How long can I wait this out for? Like, It is. I don't recommend doing that.
Yeah, the waiting out for these worms is not a good idea. Everything will be probably dead by that time because they find hosts very, very easily, as I found out for sure. But I guess the nuts and bolts of it is that there's over 600 different species, and it's pretty hard to narrow that out.
Yeah, you can't focus on not treating, right? You have to be like, I think the main goal is learning what it is, and learning that life cycle and how did it get in there, how do I fix it, how do I prevent it. Prevention is always better than treating, right?
And that's where quarantine comes back in.
And that's where quarantine comes back in. That's right.
Right. Totally. And you caught me off guard on the quarantine because I've always, I guess I'm lazy about it because I've always just done like 2 weeks, but I will definitely start ramping mine up to at least a month now.
Yeah. Well, I mean, especially you, like you have so many tanks. I mean, I have like one saltwater tank here. I'll be the first to admit I didn't quarantine my fish, but I only have like 2 fish in there. And to be honest, like all my coral, it's all fake now. Like I don't. People make fun of me. All the reefers out there, they'll make fun of me. Oh, he doesn't have coral. Hey, listen, man. I go on vacation. I come back in a month. My tank has still got the same color. I don't have to. I don't have to worry about feeding my coral or pH and alkalinity, magnesium, calcium, all that stuff. I love it. I enjoy it. And listen, kudos to people with big, like crazy reef tanks. Like that is difficult.
That's life.
Difficult. It's difficult. Hey, and even freshwater guys, right? You have so many tanks and expensive fish. Quarantine, 100%, because one day you're gonna run into an issue, right?
Yeah. Okay. All right. Next question. Can you bring disease and parasites by buying live plants for your aquarium?
Yeah, 100% you can. And that's like a main issue, I think, in a lot of tanks, like in freshwater tanks and in saltwater tanks, it's definitely coral. Not that they're harboring a parasite, but a parasite is on them, right? And you're just kind of, they're using it as
live rock is probably the worst.
Oh yeah, live rock, 100%, right? 100%. Yeah. So I mean, I don't mess with live rock. I usually just go straight dry stuff. But even though, like another thing is, I know a lot of people love live plants, but I just kind of want to throw it out there that even they've done studies on like testing cortisol level and I think it was zebrafish, and even like the different color background would cause, they would measure then stress cortisol levels, right, in the fish. So different color backgrounds would have an effect on that stress level. Taking that fish out of the water even for 1 second could increase that stress level for like hours after the fact. But they found that fake ornaments had no effect, if not better, right, than more aesthetic to the fish. So people who think, oh, I don't want to get fake stuff because my fish won't like it. It's not his natural habitat. It's whatever it is. The fish not going to know the difference. They're probably going to, you make it look like it, they're probably going to maybe even like it more. Not only that, it's going to be a lot easier to manage your tank, right?
My live plants.
Listen, live plant people are like coral people. Listen, you could do it. You can handle it. Go ahead, baby. It looks beautiful, right?
I know there's someone watching this live stream right now. His name's Jason, and his channel is Redfish Bluefish. And as far as I know, he's not the only one who does this process, but he's actually been on my live stream and showed us this process on the live stream, and that is stem plant micropropagation. And that would be what I would think the only way you could bring live plants into your aquarium and have a 0% chance of bringing a pathogen, disease, snails, anything in, because they're totally sterile when they do them. I think that's the only way you could do it and be 100% sterile. Other methods would damage a lot of plants, a lot Oh, there we go. Someone put it up there for us.
Yeah.
Yeah, like if you bleach them or peroxide them, even no planaria treatments can damage some plants. Like there's there's all
Salt, hydrogen peroxide diluted, bleach diluted. I mean, that's all good stuff. But like, you know, the more expensive the plant is, it's probably more sensitive. Even if so, like the plants are sensitive, period. Right. So
yeah.
I know, you know, redfish, bluefish seems like he knows what he's talking about with these plants. So
He's mad scientist.
yeah, you gotta check that out.
Yeah, definitely check it out. You will be interested in it. He's fantastic at this stuff. He's got the fan setups, ventilator fans, everything, man.
Nice.
Okay, so I just answered 2 questions there actually. So our next question is, and it's not a happy question, but I guess people want to know the best way to euthanize a fish.
I'm gonna say anesthetic overdose. I'm gonna leave it at that.
Okay.
Yeah. Simple anesthetic overdose, painless, depending on what you're using. But yeah, let's just leave it at that.
Okay. Sounds good. Is there any disease that can be transferred from fish to humans or humans to fish?
Yeah, the major one that comes to the top of my head is Mycobacterium.
Now, is that from fish to humans or from humans to fish?
Fish to humans. I don't know. Well, if you have Mycobacterium, you're a human with Mycobacteria.
That means you got slime, right?
I don't know what. I mean, I don't know. If you have Mycobacterium, you'd be definitely going to the doctor. I wouldn't be.
You got bigger problems.
You got bigger problems, right? So it's definitely though a thing to fish, right? So
what's that do to you if you got that from your fish? What would that do to you?
Well, I'm not like a human doctor, right? So I don't know that, but I know it'll definitely cause. So it's directly with contaminated water, but it needs a hole or like abrasions or something like that in your skin to really infect, right? So usually you'll start seeing it like rashes and things on your hands, on fingers and things, most likely, because that's where most of your hands are going to be in the tank messing around and things, which is why I always be recommending wearing gloves. But Mycobacterium is the main one. If you guys are keeping fish, look it up, do your little research on it, make sure you know what it is.
Yeah, it doesn't sound fun. I've never heard of it.
Well, if you never heard of it, then this is a great time to learn about it, right? So
sounds like it.
Yeah, like Mycobacterium species it's very odd in fish. Like you need a special stain for it, and you need to send it to the pathologist, right? The histopathologist. Like I can't. Well, I mean, if I stain myself, if I get the special stains, I probably could do it, but you need a special stain for it, and it's very vague signs a lot of times. So it's something that any aquarium should be aware of.
Okay, maybe if Zen Ginger's watching, they could figure out how to spell what you just said and throw a link up for it so people could find that, research it. It sounds like we probably should.
Yeah, it's Mycobacterium. So it's Mycoba. Whoa. Yeah, Mycobacterium. That's like the species. Well, it's like the family or whatever. Not the family. Anyway, whatever. That's the taxonomy. It's Mycobacterium, and then this specific one would be Marinum. So Marinum. But Mycobacterium species, that's the one that's responsible for tuberculosis, right? TB. So it's look up Mycobacterium. It's a lot of information, but look at it and it's interesting.
Okay. All right. People want to know about fish poop. People want to know if what healthy poop looks like and unhealthy fish poop looks like.
I mean, your fish poop is going to look brown or whatever, right? So, but what I kind of want to really emphasize here on this chat is that I don't like it when people are like, "Oh, white stringy poop, you have worms." Doesn't mean that. So the feces are going to be formed in like a casing, right? And when the fish is not eating, or there's some issue going on, let's say there's no food, it's just the casing. Right, so all it means is the fish is not eating. Why is the fish not eating? Sometimes they could also have like these like fecal like casts where they're like little tiny white like balls inside the casing. I mean, and that's not good either. But that is the most important part of that. So, I mean, your regular, brown, decent sized, normal formed stool is fine. But like the most important, like the unhealthy poop is when you see that white casing, that white stringy stuff. Don't immediately say they're worms, like, because that's not always the case. Like, you could have protozoal infections there. Yes, there could be worms, but it just means the fish is not eating.
This
Right?
means there's a problem.
There's a problem. Yeah, exactly. Yeah.
Yeah. Okay. That's. I guess if you see that, at least you're aware of it, and then you can look and see if you can spot the problems and see if you need to get a hold of a veterinarian or do more research or whatever you got to do to. And the fish just might not be eating. I've had fish that just weren't hungry for 2 or 3 days before, right? So, and I'm sure their poo would come out like that after they hadn't eaten in that long.
Yeah, right. Like, I mean, with the seahorses, for example, like they like the male when he has the babies and stuff and he's rearing them, he can go off his food, right? The female can go off his food. They don't have white poop like that. Like, I haven't seen that yet, knock on wood, but like they have a different issue. If seahorses don't eat, they could start like they could also like almost like eat their muscle away and then they can't come back from
They
it.
eat themselves from the inside. Yeah.
But long story short, I meant like anything could affect it. They could be like, hey, whatever is going on in the environment, and I'm off food, right? You just got to be able to find that cause.
Okay. Is sunken belly disease, and I know we talked about this a bit, but is sunken belly disease always from internal parasites? And what you told me when we talked was vets don't even really recognize sunken belly disease as a term.
Well, I've never heard of it as a term. I mean, I could be wrong, right? But and all the books that I have that I try to look it up in, I could not find anything like that. So I think it's more of like, a clinical sign, like something is wrong, right? So you got to do your exams, you got to do your tests, your diagnostics, and say, hey, what's going on? Is the fish eating? Is it not eating? Do your fecal exams. Is there a protozoal infection there? Is there? He could be eating, and he could have an infestation of protozoans. Who knows, right? But unfortunately, I'm not good help on that one.
No, it could be anything. It could be an intestinal block. It could be absolutely anything with them.
Right, but it's not just, yeah, you're right. But I guess his focus is it internal parasites? It could be anything. Pretty much that's your answer, I guess.
Yeah. Okay, so this question's a little bit preloaded, and this is the question: are you struggling to have medications available from suppliers? Now, there was more to this question from the person who asked this question was from British Columbia, and I guess they were frustrated with their veterinarians out there are actually having issues with bringing in the medications that apparently they're able to prescribe. Have you had any of these problems in Ontario, or are you good to go if you're hired to see a patient and they need those medications, the patient being the fish, they need those medications, you're pretty much readily able to get them, or is it still a problem?
No, it's not really a problem. We can get the medications. It's just depending on like what it is and like what type of medication it is, like in what form. I like to get my medications in the pure form. I mean, other fish vets who are like strict fish vets, there's licensed medications for them. They are expensive and they're large quantities. I don't get that, right. I can't do that. So I usually will go to compounding pharmacy and get meds in the pure form. So it is a little bit difficult sometimes, but like once you develop that relationship with, the compounding pharmacy, then you can kind of they can facilitate that. Interesting enough, I use a lot of chloroquine phosphate, and the government intercepted one of my orders because they're using it for COVID-19 right now. So obviously it's going to better use, but so that I can't get. I mean, I like that medication. I like to use that, but
Huh.
yeah.
I guess right now, what are you gonna do, right?
I mean, it is what it is. I mean, I'm not seeing fish right now, right? Like, unless
human lives matter.
yeah, exactly. Human lives matter. But it
So
is what it is.
I know you didn't have any problems getting me medication. It was actually very quick. It was quite quick, and that was levamisole. And you did, like you just said, got me pure powder, pure levamisole. And yeah, it worked pretty quick. So I guess the answer would be depending on your location, depending on where you live. If you live nowhere near a veterinarian, it would be hard for you to get to the vet, hard for the vet to see your fish, hard for everything if there's geographical issues, I guess. But most vets should be able to get the medications you need if you guys have gone the right routes to get there.
Absolutely.
Oh, we're on our last page.
Yeah.
This is actually probably a pretty important question. It sounds like a simple question, but there's probably more to it. The proper way to dispose of a deceased fish.
So this is dependent upon your local municipality. So I mean, I would say cremated or landfill. Those are probably the two ways. But every municipality is a bit different. So if you're keeping fish, then obviously contact them and see what they say. But landfill is usually the.
I'd say because you don't know what it died from.
Oh yeah.
What it died from, right?
Oh yeah, 100%. Especially people with big fish, right? If they're importing fish and things like that too. If you have ponds, right, and you have koi, yeah, absolutely, yeah.
Yeah, and not only that, even your smaller fish, if you don't know what they died from, you don't want to be flushing them and putting them into our water system, right? Into tanks and stuff.
Do not flush the fish.
Yeah, I don't think that can be emphasized enough. But yeah, you're putting a lot of stuff that we shouldn't be back into the environment. So landfill, I would suggest maybe tie it. I know how I do it. I tie it up in a bag before it goes to the landfill. But
wear gloves, all that, right? Personal protective equipment, wash your hands after, everything like that.
Yeah. Okay, perfect. The next question, I think you already answered this question, but we'll read it out anyways. For fish breeders with many tanks and many fish, would you need to see and treat individual fish or as a group? I think you explained that while we were talking about my situation when I hired your services to help me with my fish. You just need to see the person's setup, establish a relationship with the person's pet that needs the attention, and you're good to go from there. So I guess if you're seeing everybody's fish in their whole setup, you're okay just seeing their complete setup.
Right. It depends. Yeah, I mean, it depends on it depends on what's going on and what fish are affected. But yeah, definitely it depends on what's going on. Like if you brought me a fish, I don't know, like if you brought me one fish and I was like, oh, this is an infectious disease or something like that, I'd be like, okay, you gotta treat the whole tank. Like I don't have to see every individual fish. It's like I'd like to, obviously you could send me photos and things like that, but like if I got a strict diagnosis of what's going on, it's better to help them out.
Yeah.
So it's a case by case basis, pretty much.
Yeah, that's probably the best way to put it. If you have a bunch of fish and you're having the same problems in all your tanks, I guess you treat them as a whole. If not, it depends on the situation. Whether it's ponds, it's not always tanks too, right? Sometimes it's ponds. Sometimes it could be anything. Here's a big question, and I'm sorry, people, I don't follow the chat very well. I'm too busy trying to have a conversation, which is
I keep looking.
But I did see this. There's been a couple of people have asked questions about fin rot, preventative measures for fish that are prone to fin rot.
Right. So, fin rot is technically fin rot is like it's almost like a cold water disease. I mean, you have 3 different types of bacteria usually in there: Aeromonas, Pseudomonas, and something else. Another one, I think, Cytophaga or something like that. Anyway, so that's fin rot. But in these long-haired stuff, you have this kalamatas, right? The gill disease, which is Flavobacterium. So they're both very, very same, except the difference is the temperature. Like the main difference is one occurs in a different temperature than the other. But long story short, water quality. That is the issue. Like to be honest, the majority of cases that we see as fish veterinarians are water quality based. But if you think of any stressors, so change in pH is huge. You know, every point in pH is, you know, tenth of a power, or whatever, right? So like 1 point can drop from like 10 to 100, you know what I mean? And you keep going like 10 to the second power, you know?
Mm-hmm.
So pH, any changes in pH, drastic changes in temperature, or quick changes in temperature. Yeah, drastic would mean the same thing. Increased ammonia, decreased dissolved oxygen, all stressors, trauma, stress from handling.
So what you're saying basically is habitat,
Overcrowding, everything. I mean, it comes down to all of that. Well, not all of that, but most of that is related to water quality.
So if you improved your water quality, that will improve your situation.
It'll help it out, right? I mean, if you have an abundance, like a really, really high bacterial load in the water, or you had like really dirty water, that's going to obviously have a role, right? But at the end of the day, like the better the water quality, the less stressed the fish is, the more he could defend and fight off, you know, those parasites or bacteria and things like that.
I guess it's no different than us, right? If we cut our finger and we keep putting bacteria on our finger and keep putting it on, we're going to get an infection eventually if we don't clean it somehow or try to keep it clean at least. So the fish live in the water, and if they have dirty bacteria-ridden water, I'm assuming that essentially the same thing, right?
Sorry, repeat that. I was reading some of the comments here for a second. Repeat that one more time.
What I was saying is it'd be no different than if we cut our finger or something and we just kept exposing it to bad bacteria to bacteria to bacteria. The same with the water quality. If you don't keep the wound clean, it's not going to heal.
Yeah, that's a good point. Yeah, that's very good. So that would be like an abrasion, right? I'm almost thinking like, how do I put this? So like if you could try to make an analogy, this may be a poor one, but let's say vaccines, the way the vaccines work is you inject a small amount, right, into the body, and then the body will kind of start building antibodies and fight that off, right? But if you were exposed to, like, a vaccine is like X amount, right? If you are exposed to like a huge amount, your body's definitely going to fight it off and you're going to build antibodies like what a vaccine would do. But that load is going to be so much, you're going to get sick. You know, you're going to get sick. Something's going to happen. So, yeah, I think that's like kind of a good way to describe it, I would say.
Okay. So do your water changes, people.
Do water changes. Keep strict. Oh, yeah. Another thing that I really want to mention is I always hear people say doing crazy water changes. Oh, do 75, 100% water change. I never do greater than 50% water changes. Why do I never do greater than 50%? Is because the change in pH is going to be drastic, and that is going to cause an issue. So please, people, like, keep that in mind. And I think that's like a huge. I mean, I always see people say, "Oh, I do 75% water changes all the time, all the time, all the time." But like, you got to match, and every time you do water changes, you should be matching everything the same, right? Temperature, pH values, and everything like that. But
most definitely. But yeah, it's a huge stress I find on fish doing huge water changes.
yeah,
Smaller, more frequent is the correct path. And interesting note, I know a couple of people in the Berry Club, actually, the Berry Aquarium Club, excuse me. They have auto change drip systems on their tank. And I think that's absolutely, if you have the time and money and space to be able to do that, to have a constant drip of fresh water change, there's like zero impact on the fish, and they always have the freshest water ever. That's what I would do if I was serious about a real serious setup.
Oh yeah, I would love something like that, and maybe I would love that. I don't know if my wife is going to allow me to get any more fish tanks or anything in the near future, but next one I may incorporate something like that.
Yeah, Steve Langley and Barry, actually, I did a video, fish room tour video of his place, and he's got an auto drip system. This was before, when we were actually allowed to go over to each other's houses and stuff. I did a video of his fish room, and he's got a pretty neat little drip system, and he explains it pretty well in that video. It's actually pretty simple and cheap to do.
Yeah. I know Steve. He's a nice guy, really nice guy.
Yeah, he is. Yeah, he is, for sure. I don't know. That's awesome. You put out more information tonight in this hour and a little bit than I think a lot of people have gotten in a long time. What I hate is bad advice in the hobby. When you get on Facebook and whatnot, you see people just spouting off that like they're god of the fish keepers, and they've owned a tank for a month. They've maybe got a YouTube channel going. I don't know, and they're all of a sudden professionals. But they're giving out just crappy advice. And I know some advice can be taken one way or another, but some advice just shouldn't be ever taken. And that's why I like doing these things and bringing on insightful people like yourself and all the other guests I've had on to get some good advice out there. Give us something to talk about in these times where we can't go over to each other's fish rooms and hang out. And I think we're being part of the solution, not the problem, by doing stuff like this.
Yeah, man, I appreciate it, and I'm just trying to help and trying to educate people as much as possible in the community and help them out. And yeah, I agree everything you said. It was been a lot of fun coming on here, and you bringing me on. I was so nervous. I don't like public speaking or anything like that. But
you did very well.
Cool. Huh?
Yeah, you did very well, and I think people got an immense amount of information out of this, and even just so that they know where to go if they do need the information. It starts with a phone call, right? Starts with a phone call. Call your vet, have a talk. It generally doesn't cost nothing to have a talk about the problem. So why not at least go that far? It found me solutions for problems I was having. Yeah,
and I wish people, to be aware. Try to communicate with your veterinarian and see if your veterinarian treats fish. And a lot of people complain the medications are expensive. They're really not that expensive. You're getting good quality medications. They're not expired. You're getting appropriate dosages. The only thing you're really paying for is their time and their information. We work for you, right? So any questions that you may have, you could ask us, and if we don't know it, we will look it up, and we will do everything we can to help you out, right? So if you have any questions, just go to your vet and follow me at at the Fish and Bee Vet, baby. Not baby, it's just at the Fish and Bee Vet.
You're getting comfortable now. You're getting
But
less nervous. You're gonna be a YouTube regular for everybody shortly.
I post up educational skits for like fish and bee medicine. So yeah, you can follow me, and hopefully, and I've incorporated a lot of my hobby stuff like the copepods and all that stuff. But yeah, follow me, and hopefully you enjoy it. And
Yeah, no, that sounds totally cool. And I'm watching the chat a little bit here, and we got your webpage up here again, where they can find you at Allendale. And I had it up earlier. Someone's going to have to go through after. I had your Twitter account up there as well, so people can watch the replay of this as well. That's the cool thing about these live streams is we put them up live, but people can go back and draw information from them after. They're posted up forever, and I can actually take little clips from it too on specific topics. If we got enough information on it to do a little video of it, I do, and then we got that information. It works out really cool. It's a cool way to share information, and I thank you so much for coming on. Am I your first time coming on YouTube?
I think you were my first fish client as well.
First fish client.
You were my first fish client, and you were like my first like big fish client, and yeah, first time on YouTube, right? First time on YouTube. One of my buddies, he was watching earlier. He was telling me, I think he's actually watching still right now, and he, Vinny Zap, 26. He was telling me, hey, you should do a little video, right, of Instagram and for your bees or whatever, your fish, and then what do you know, like, you hit me up, and I texted him. I said, yo, but I said, yo, buddy. I was like, one of my buddies is asking me to talk on his chat, but first time. It was first time. It's great. I enjoyed it.
Well, you did a great job. We got lots of information out there. I hope I kept things relaxed enough for you. I like to keep things relaxed. I don't like it to get too serious or out of control. We're just doing this for fun. But yeah, really appreciate it, Paul. And I think we're going to wrap this up. We've extended our time quite a bit here, but we got a lot of really cool information out. So once again, thank you very much for coming on. And for anybody in the Barrie area, and I'd say would you stretch to Aurelia, Newmarket?
Yeah, wherever. I mean, listen, I don't want to say I'm not do whatever you gotta. I can't really talk about like all that, but
yeah.
But
if you're in the area and you need help, reach out. That's what I'm saying.
Sounds good. Sounds good.
Okay, buddy. Thanks for coming on. Enjoy the rest of your evening.
All right, you too. Thank you. See you later, everybody.
All right, everybody else watching, thank you very much for watching. If you put a question in the live stream and we did not get to it, I apologize for that. But we had a bit of a plan set out because we want to get as much information out to you as we can, essentially, in the short time that we had to do it. I think we've done that. If you missed it, go back and watch a replay. There was some very cool information that we have out that we got out today. And yeah, it's not every day you get a veterinarian on a live stream. So everybody, from us to you, happy fish keeping, stay safe, and take care until next time.